My name is Andrea Richardson, and I am a doctor of audiology. When I was a grad student, I helped with Dr. Gerard and the Conservatives to pass the Universal Newborn Hearing Screening Bill. It was fully implemented in 2016 to ensure that every baby born in this province has their hearing screened at birth. I worked for 6 years at Manitoba First Nations Education Resource Centre, also known as MFNERC, developing an educational audiology program providing audiological services in remote communities in Manitoba. Currently, I am co-owner of Ears for Life Audiology, the only pediatric private practice clinic in the province. There are only 42 educational audiologists in the entire country of Canada, and we are 2 of them. The goal of the standing committee is universal screening for learning disabilities/difficulties for kindergarten to grade 3. Now, as we all know, we learn through our senses. Hearing ability has a direct correlation on learning to read, write, and spell. If you want to imagine a pyramid, reading is at the top of the pyramid, the level below it is language, and how we develop language is the bottom part of this pyramid, which is hearing. A 2-year-old, they learn language not by speaking, but by sitting on the ground playing and listening to the adults having conversations. They need to be able to hear to do that. If a child has a permanent hearing impairment or fluctuating hearing loss, now a fluctuating hearing loss refers to children who can have head colds or chronic ear infections. At any given time, 30% of school-aged children will have a fluctuating hearing loss. Now, including children with an auditory processing weakness, they are going to be at a disadvantage to learn language, and that will directly correlate with how they learn to read, spell, and write. Any degree of hearing loss causes an individual great difficulty understanding speech in noisy environments such as a classroom. As you can see right now, I'm speaking into a speaker, right? This is essentially improving your access to spoken language. If I wasn't to have this, you would all be straining to hear, and you as an adult, you can say, speaking to the speaker, I can't hear you. But if you're a little 6-year-old and you don't have the learned experience, the life experience, you're just gonna sit there and go along with it. Kids just wanna be compliant, they just wanna learn. That's just, they're little. Let's see, where am I? So Elizabeth Adams, PhD, clinical psychologist at the River School in Washington, DC, stated that having a strong language foundation is central to learning. She says, without this strong foundation, there can be some academic gaps, but if a child has a language model they can access, they should be able to learn. When we were with the organization MFNERC developing the audiology program, our first goal was to perform hearing screenings to identify children with possible hearing loss because approximately, this is on the low end, this is old, it's probably way higher now, approximately 12% of school-aged children have a permanent hearing loss and only 4% are diagnosed. Because hearing loss can happen at any age. Children should be screened in kindergarten, grade 1, 3, 5, 7, and 9. Currently, many schools only perform hearing screenings in kindergarten and grade 1. Doing the hearing screenings helped us identify children with hearing loss and alert our educational psychologists to these children. It was a great model. We had all the services under one roof, so we could just walk down the hallway and we'd just talk to everyone. There were no boundaries, no red tape because everyone was all housed. So if the children were on their caseload for an evaluation, the educational psychologist would borrow a personal assisted listening device to help ensure the child was getting all of the auditory information necessary so the hearing loss would not skew the results. That being said, they would also use the devices when they suspected hearing loss and or other attentive challenges the child may be experiencing. When you're talking about universal screening for learning disabilities difficulties, you have to ensure that the children have normal hearing before screening them, or you may not be screening for what you think you are screening for. In a classroom, we would like the teacher's voice to be louder than the ambient noise. Sorry, I lost my place. In truth, right, it is the same volume or softer. Volume drops in half every 6 feet. So that child at the back of the class is missing a lot of auditory information. That's why we're always told to sit near the front. As an adult, you stand at the back of the class. You naturally feel that you are hearing everything. However, your brain fills in the blanks for the things that you aren't hearing. This is how you get along in a noisy environment. Restaurants, all those types of social gatherings, all that kind of thing. Once again, I allude to a child does not have the language history to fill in those blanks, so they feel like a deer in headlights, and they smile like they hear you, but they don't understand you. And that's been alluded to with a lot of the children that are the learning disabilities. Young children are always, this is part of auditory processing, which doesn't fully develop until a child is anywhere between 12 to 18 years of age. Young children are always at a deficit in a classroom unless they have adequate access to spoken language. One way to ensure that they are hearing everything is the use of a sound field system. It helps all children. There are studies that have shown that spelling tests and reading greatly improve as a result of the use of a sound system in the classrooms. I had 2 grade 5 students that had hearing loss, but were not hearing aid candidates, which happens, the fluctuating hearing loss, minimal hearing loss. So we put a sound field system in the classroom, and to be honest, the teacher was super reluctant to use it. That happens, my voice is loud enough, I have a teacher voice. No, that's a myth. However, by the end of the school year, the students were moving to a new class and the system was moving with them. She wanted to keep it because it made such a difference in the learning environment in the classroom. Creating that positive inclusivity, making that, changing it so I'm struggling, but now I can hear the teacher, even though my hearing may be normal, I'm not distracted by all that other stuff going around me, which is what a sound field does. We have repeatedly heard, she wanted to keep it. We have repeatedly heard this from every classroom teacher. Once you put it in, they don't ever want to give it back because it helps their voice too. They don't have to. As soon as we raise our voice, our intonation changes, and now kids are really sensitive to those changes and then just going to shut down, not go to school, don't feel welcome, warm, safe environment, so they go down another path, which has been alluded to too. So I'm just sort of backing up everything that's being said. There are even pass-around microphones that can be utilized, and this helps teach turn-taking, public speaking, and encourages classroom participation, because you got to be like a rock star. McSporan from 1997 argues that possibly the most cost-effective, appropriate, and acceptable way of maximizing the classroom acoustic environment is through the use of a signal-to-noise enhancing technology, sound field system, speakers. By hearing what is being taught, every child benefits and enjoys a higher degree of achievement. The goal of Bill 225 is to identify students who may have a learning disability difficulty. To not let these kids fall through the cracks, because to be honest, when kids from the clinic, when we're doing auditory processing testing, we have kids that are getting 90s and like 80s and 90s, and they've just been struggling and they're older, so they know something is wrong, and they encourage their parents because parents have no idea. And then you're just amazed at the amount of work that these students are putting into just maintaining, just so that they can keep up appearances. They're working, every student's worked hard, but this is just, you can just see that despite the challenges, they're still performing at a high level. And it's not intelligence, it's just they learn differently. We would like to see the Standing Committee to understand the importance of hearing and learning disabilities in the classroom. Number 1, students from K to 3 need to have their hearing screened prior to any learning disability screening. Number 2, if a hearing loss of any degree is present, it needs to be addressed before screening for a learning disability. Number 3, I think I said 3 twice. Once a child has been diagnosed with a learning disability, they should be provided with access to spoken language, hearing loss or not. To provide that, it is the use of the sound field systems in the classroom. The sound field systems help create that level playing field for the children, and it just changes, the game changer. It's thinking outside the box. If this is passed, Manitoba could be like the gold standard for all other provinces. And the educational audiology, we're starting our own association. Long story short, we're trying to create that sort of standard so that you can go onto the national board and you can see all the resources for all things learning and hearing And it's our chance to shine. And we've been saying this for years with regards to sound fields and hearing and learning disabilities, just difficulties, and we see it firsthand. So this is just a positive thing, and it's thinking outside the box, and everything that's awesome needs to be changed, and we can't be scared of change. We just have to just jump in and do it, and I speak from experience, because if I hadn't, as a grad student, pushed...
Sorry to interrupt for just one moment. I just have to ask is there leave from the committee to allow her to finish the presentation? Agreed, okay.
If I didn't... To be honest, and that was we started doing the talking in 2009. So, yes, change.
Thank you so much, Ms. Richardson, for your presentation. Yeah. Emily Lamoureux.
Thank you, Honorable Chairperson, and thank you, Dr. Richardson, for your presentation and just the reminder to highlight the importance of hearing before a screening test specifically. I actually have two questions for you, if you can answer. Do you know if there is any mandate in education for access to spoken language? It's one. And can you expand and share a bit more about what auditory processing is?
Okay.
Ms. Richardson.
Oh, sorry.
Yep, go ahead.
I've been sitting here for 2 hours. You think I would know the routine? Nope.
It's all good.
Sorry. There, regards the mandate to education for access to spoken languages is kind of interesting. If you attend post-secondary and you're in the workplace, they have to provide accommodations, and it's based on the duty to accommodate and the Accessible Canada Act and the Canadian Human Rights Act. But if you're in K-12, there's nothing. I don't understand that. But anyways, and then with auditory processing, basically it's what we do with what we hear. And it's normal hearing, but you can still have difficulty understanding. And it can coexist with other diagnoses, such as 96% of children with dyslexia will have APD, auditory processing. Approximately 70% of children with ADHD have APD. And children who have chronic ear infection or who may have had a head injury may also have APD, and there is also a genetic component to it as well.
Thank you, Ms. Richardson. And Emily Cross.
Thank you for your presentation. I've already kind of spoken about my journey through teaching. One of the jobs I had in the education system was I did vision and hearing screening in River East Transcona School Division. I don't know if that still happens. That was many, many years ago. And if it is happening, can you tell us at what age it's happening? Is it happening in all divisions? Is it a standard right across the province?
Ms. Richardson.
There is no standard across the province. The Winnipeg School Division, I know they have a very successful, they're the only school division that has a very successful audiology program. And, but as far as other school divisions, I don't know. Like I said, most schools only do K and 1. But I just don't know that there's that standard. And once again, there's you can train anyone to do the hearing screening, to be honest. But it's just finding that time to do it. And it's not hard. I was just up in St. Teresa Point. I go there once a month and do all the hearing. We screened early years and middle years in 3 days. And I got all the information, all the data, just like what we need, raw data. And I did all the grades, even though we were supposed to be very opposite, because it had been so long and I wanted all the data. And this is awesome. You would think that there would be a higher rate. Well, when I broke down the numbers, gotta love science, math, the numbers aren't any higher as opposed to what the world expects. So it's just a lot all at once, but then once it all gets on that path, then it'll just be easy to maintain. But it's just getting that initial data, which I'm very happy to say that I was able to do, because that data has never been obtained before.
Thank you. Emily Cook.
Hi, thank you so much for coming and for sharing this very important information. I just wanted to validate some of what you said from like a layperson parent perspective. I have some experience with personally with early hearing loss and the impact that it makes when you know that it's a problem and you can intervene to address it. And I've also seen in some of the classrooms I've gone into sound field systems, like you talked about, I think that's something that would be really worth exploring, that, we should mention to the minister to look into, because, we get to go into classrooms for I Love to Read Month. And I remember being in one classroom and the teacher gave me the microphone, which was just a thing you wear around your neck, when I got to read. And what a difference it makes for the kids in that classroom to be able to hear clearly and without really trying. So thank you for bringing that up.
I just want to touch on that.
Ms. Richardson?
The look on the kids' faces and the teachers' faces, it's just, you can't take that away. And that's at any age. The kids, because we installed them in the classroom and up in St. Therese, and the kids just love it. They're like, the best part is when my teacher remembers to wear it. That's a whole other thing. Anyway, but it's just, you don't notice that immediately, and that just helps overall the learning with the learning difficulties, disabilities over time. And it's such a huge difference.
Thank you so much for your presentation tonight. Thank you.